Hello, my name is Mr. Tahir Khalik. I'm one of the clinical governance fellows at the University Hospitals of Birmingham, and today I'll be talking about the tendonitis. We'll talk more about the background information, the causes, symptoms, clinical features, investigations, and then treatment. Achilles tendonitis is the inflammation of the Achilles tendon, and it may be associated with other abnormalities such as retrocalcaneal bursitis and deformities such as Higgins. Majority of the causes are because of microtrauma, overuse, especially running, high heel shoes, antibiotics such as ciprofloxacin, and inflammatory arthropathies. The symptoms that the patient may suffer from is pain and stiffness in the morning, severe pain after exercising, often the next day, with thickening and swelling of the tendon, with insertional tendonitis such as bone spurs. The clinical features that should always be assessed is pain on palpation of the Achilles tendon with sometimes swelling. There is pain on dorsiflexion of the ankle, which improves on plantar flexion, and always we need to check for Simmons test, and this is to rule out any tendon rupture. The investigations or the management starts always with a history and examination with an x-ray, and it may be normal. However, calcification deposits within the tendon can be seen near its insertion, and that's almost 60% of the cases. The next step would be an ultrasound, both in static and dynamic modes, and then an MRI scan would be used for diagnosis. Treatment can be both conservative and medical/surgical. Conservative, it could be more about education and activity modification with physiotherapy and eccentric exercises, while orthotics can also be used with a heel sleeve or pad or small heel lift. Medically, you can start off with medications such as NSAIDs and platelet plasma injections, or with extracorporeal shockwave therapy, but steroids are contraindicated and should never be used. Surgically, it is rarely used. However, there are certain methods that have been written in the literature, and one of them being the release of adhesions or tenotomy, along with open excision of degenerative tendons, retrocalcaneal bursa excision, and resection of any deformities, and for insertional Achilles tendonitis. However, at the end, you can also do a tendon transfer from the flexor hallucis longus or the flexor digitorum longus. Thank you very much.